For those of you who don't know me, I'm Nara Parameswaran. I'm a physiologist by training, and I'm also a senior associate dean for research in the College of Human Medicine. And thank you all for coming to this. So our next speaker, so we have four speakers lined up. Our first speaker is Dr. Felicia Wu. And Dr. Wu is the John Hanna Distinguished Professor of Food Safety Toxicology and Risk Assessment, as well as University Distinguished Professor at Michigan State University. And I'm not going to spend like 5 minutes to give introductions. I know these are flash talks, so I'll be short and be to the point. There were a couple of things I wanted to highlight about Dr. Wu. Her work is at the nexus of agriculture, food safety, and nutrition to improve global human health outcomes. So it jives with everything that we're talking today. I also wanted to state that she's a co-chair for the U.S. National Academies of Science, Engineering, and Medicine Committee on Biosafety, Biosecurity, and environmental issues related to synthetic cells, as well as on committees for WHO. And most importantly, for Michigan, the governor of Michigan appointed Dr. Wu as a commissioner for agriculture and rural development for the state of Michigan. So with that, Dr. Wu.
Thank you. Well, following that wonderful talk by Dr. Alamad, now I'm going to focus on one other area of climate change and how it affects human health, and that has to do with the indirect impact of climate change on different food contaminants and how they will affect our food safety and therefore our public health. And this is work done in collaboration with my colleagues listed here. So there is no question that climate change is going to be compromising food safety, not only now, but very much more in the near future. We're going to see an increase in the presence of microbial pathogens, viruses, bacteria, protozoan parasites, ones that you've heard of, and these are common not just in food, but also in water. As far as the chemicals and toxins, you probably know about, since we live in the Great Lakes region, most of us, we know that the presence of harmful algal blooms is ever increasing as a result of climate change. In fact, actually last year, there was the first harmful algal bloom in Alaska, off the coast of Alaska. So this really is becoming a problem everywhere. And this leads to a number of algal toxins being present in our seafood, particularly shellfish, like oysters, mussels, and clams, and lobster and shrimp and crab. There's also, oddly enough, an increase in the presence of soil-borne chemicals that get taken up into our food crops, including arsenic and PFAS. And the reason is that under heat stress, plants are more likely to take up water from the soil, and those that are anionic, those chemicals that are anionic, including arsenic and PFAS, get then taken up much more easily. So there'll be more presence of these chemicals in our food. And I'm going to be focusing my talk on the last area, which is the increase of mycotoxins or fungal toxins, including aflatoxin in our food supply. Aflatoxin is the most well-known and the most toxic of the known mycotoxins. It's produced by the fungi Aspergillus flavus and A. parasiticus and is common in our corn, our peanuts, our tree nuts like almonds and pistachios, and various spices. I always used to preface my talks. I've been working in this area for 25 years, and I always used to say this is a real problem in the band of the world that's between 30 degrees north and 30 degrees south latitude. That is no longer the case. It has really expanded its reach. And still, however, it is mostly populations in Africa, Asia, Central America, and the US South. Some of the human health effects associated with aflatoxin are liver cancer. This is the one that's the most well known. And we've known about it for 60 years that aflatoxin is the most potent human hepatocarcinogen, particularly if our livers are otherwise damaged because of chronic infection with hepatitis B or hepatitis C virus, and now particularly increasingly in the United States with liver disease that's associated with metabolic dysfunction, obesity, and diabetes. It can also cause acute aflatoxicosis at high doses. And aflatoxin has also been associated with childhood stunting and dysfunction of our immune systems. So basically, when you see corn and peanuts that look like that, try to avoid eating them. Those are infected with Aspergillus flavus and parasiticus, and they contain aflatoxin. The good news in the United States is that the Food and Drug Administration monitors and regulates aflatoxin at the action levels. So we are never in our human food supposed to be exposed to more than 20 parts per billion aflatoxin. What happens then as a result is that so far the main effects of aflatoxin in our corn and our peanuts in particular are not so much to humans and to animals in terms of health, but primarily economic, and especially to corn growers. So my colleagues and I did a study that was published in 2016 that looked at 3 consecutive years in the United States, 2011 to 2013 inclusive. And what we found was a little bit surprising even to us, that the economic losses to corn growers vary so substantially, from about 50 million in terms of aflatoxin-related losses because their corn was rejected at a grain elevator, to over 1 billion in some years. What was that kind of harmful year? That was the year 2012, and those of you who lived in the Midwest in that time probably remembered that 2012 had a very hot and dry summer. So aflatoxin, which is mostly a problem in corn grown in Texas and in Louisiana and Mississippi, spread northwards to the Corn Belt and caused enormous losses even in Iowa, Illinois, and Indiana. And not just in 2012, but anecdotally, years such as 2005 and 2006 also had very hot and dry summers in the Midwest. Aflatoxin was not just a problem in the South, it spread to the Corn Belt. And so we wanted to answer the question, is near-term climate change going to increase aflatoxin risk so that this is not anymore a sporadic risk in the Corn Belt, where we're producing most of the corn for the entire world, but going to be much more likely? We looked at crop insurance claims as a way of answering this question. Anytime corn growers filed an insurance claim, specifically because the aflatoxin levels in their corn was too high. And then we developed and validated a model of aflatoxin risk measured by those insurance claims as a function of maximum and minimum daily temperature for every single day from May through October, so basically from planting to harvest, for every single county of the United States in 16 states. Average rainfall, grower practices, relative humidity. From the years 2011 to 2020, we validated this model and then we used it to project aflatoxin risk for the years 2031 to 2040, averaging together data that we collected from 16 different climate models that were available on the NOAA site. And we averaged maximum and minimum daily temperatures that were projected until the year 2099. But we focused on near-term climate change, the years 2031 to 2040, using a representative concentration pathway of 8.5, which means an additional 8.5 watts delivered to the Earth per square meter of the Earth's surface as a result of carbon equivalents in our atmosphere. This is the econometric model that we used. These are some of the results that we found. What we really do not want to see is a hot, dry July and then a wet September. And unfortunately, in many parts of the Midwest, in the after silking period, which is in July, there's going to be a lot more dry days in the Midwest. After then, there's going to be more wet days. And you can see that the temperature is also going to be much hotter in July in the near-term future. This is going to result in more aflatoxin-related insurance claims moving northward into the Corn Belt, and in particular aflatoxin-related costs, particularly in this next decade. So very, very soon, coming up in 6 years, in Kansas, Missouri, and Illinois, and you can also see that the levels are higher in Iowa and in Nebraska. So we can see that this is really going to be a problem in a matter of just a few years. What are the implications of these results? Aflatoxin levels are increasing. These problems are going to intensify in the part of the world that is supplying most of the corn, not just in the United States for human food, animal feed, and for ethanol production, but most of the human food all over the world. We see some minor results, such as that the risk is going to decrease in Texas, and that is simply because it's going to get too hot for the fungus to survive, but that means it's going to be too hot for the corn to survive as well. Right now, we're supplying about 40% of the world corn exports. And so this is a pretty serious problem that we do need to deal with in a variety of different manners, and we need to think about more seriously. So this is a summary of the work. Please feel free to contact me if you're interested in these topics of food and water safety, and particularly climate modeling. Thank you.
Thank you, Dr. Wu. Our next speaker is Dr. Shailendra Sharma. Dr. Sharma is a nephrologist by training. He's also a clinical associate professor in the Department of Medicine at Michigan State University. and is also at the University of Michigan Health-Sparrow Hospital. And he has done some collaborative work with our plenary speaker Barack, and his work is primarily focused on relationship between heat stress and the kidney health. He's consulting nephrologist for Ensure Nepal. His funding is from the similar project from the Last Law Network in partnership with the Department of State. And he's also investigated labor migration from Nepal and heat-related occupational health illnesses abroad. He's a co-founder and president of the Global Health Advocacy and Research and serves on the Scientific Advisory Board for Nepal Development Society. Dr. Sharma?
Thank you for the intro. For a while, I thought it was somebody else. I'll do my best for the 5 minutes. I take this challenge because part of a project that I'm involved in is going to be talking to the youngsters and youth. So specifically the group with very short attention span. So this is a very powerful picture that I always want to start my talk with. This is a wall in the Lusail Stadium in Qatar. And this wall is filled with these pictures and honors folks who died during the construction of the project. New York Times covered it in an extensive article. And in fact, this is how I got into this space of heat and the intersection of heat and health, and then ended up in this fantastic journey. I don't need to preach to choir. This is the Robinson project. We started doing this from the 1881, and then if you fast forward it to 2020, 2024, this is what we've become. What is even striking to me is that when I first started hearing about global temperature anomaly, the denominator used to be decades. And then in a very short period of time, our denominator became years. And now we've come to a position where we start talking about it in terms of months. We just had a 15 months of consecutive monthly record-breaking heats, an unprecedented heat streak. And this is just to kind of summarize how we have seen the anomaly unfold in front of our eyes. And we didn't really have to go back as far, but just from the 1960s, and this is where we are. Bear with me for this busy slide. I borrowed this from Lancet, which is from 2021. And what I'm trying to showcase here is that in response to extreme heat and heat stress, the innate response is to distribute the heat peripherally. You vasodilate and you shunt the heat in the periphery so that you can lose heat by convection, you can sweat. What happens is that here to the right side, I'll start with how the vessel starts to dilate. Your blood pressure starts to go down. And how the heart has to compensate is by working faster and working harder. So that combined with a low drop in the blood pressure is increasing the myocardial or the cardiac oxygen requirement. So it's a double whammy. So there's no wonder that in the conditions of extreme heat stress, we see cardiac ischemia, myocardial infarction, and cardiac collapse and sudden cardiac death as well. To the left side in the bottom is my dear organ kidney. You sweat, you have increased insensible losses, and oftentimes when that's combined with the dehydration, you get into a low volume state and a kidney injury. And that kidney injury can be tied to a much worse negative cardiovascular outcome because there's a breadth of data that coexistence of kidney disease and heart disease, one feeds the other and one contributes to much negative outcome. But it's just not the kidneys and the heart, but when you have a central hypovolemia or hyperperfusion, then your gut starts to feel that. It releases endotoxins. And then the cells go into an apoptosis or early cell death. So it took us a while to understand the complexities of heat stress and how that negatively affects our health. But I'm going to take you back to 1889. This is a painting by Van Gogh. It's called a Siesta, After Millet.
In a sun-drenched field, two peasants take a break in their day of toil and sweat. A rural scene that illustrates in itself an almost commonplace truth. Work and heat have never gone well together. In 1889, the year Van Gogh painted this scene, the world was just entering a new climate era without yet knowing it. An era marked by an unprecedented warming of the Earth's climate. The last 8 years have been the hottest ever recorded.
This takes us to 2022, but we have shattered our records in the following years. So the two following slides are dedicated to my organ, kidneys. What I really wanted to stress out here is that we always talk about heat stress, and we know that heat stress is related to or can result in a kidney injury, incidental kidney injury, acute kidney injury. But what we're also increasingly noting or learning about is that there are certain heat stress modifiers. So the intensity of exposure or the intensity of heat stress is directly proportional to the intensity of kidney injury. And when we talk about heat stress and the resulting kidney disease and kidney injuries, we should also not forget about the associated risk factors. So I get this counter narrative that it's just not the heat. The person has more traditional risk factors of high blood pressure or diabetes. But if you add heat stress to the pre-existing risk factors, that takes us to a very dark place. And one other entity that we have started to know more and more about is that we've always known when you are dehydrated and you have a clinical acute kidney injury shown by increase in the serum markers that tell you unequivocally that there's a kidney injury. We've known that acute kidney injuries results into a chronic kidney disease and a chronic kidney injury. What we did not know is that when you have a heat stress and heat exposure and the resultant dehydration, then you go through a phase where subclinically you induce fibrosis, you cause more systemic inflammation, you have more oxidative stress environment, and that will lead to a chronic kidney disease. These are the phenomena that happen in a very subclinical manner. Nothing dramatic. It doesn't take you to a caregiver or a provider. And even if you were to do a blood test, you may not have what is considered to be clinically an acute kidney injury. So the phenotype of this kind of kidney disease, I'm kind of piggybacking on Barack's slides, but the phenotype was described by Ramon Garcia in their seminal paper from 2000s. What Barack talked about and what we have started to see more and more in relation to heat stress and kidney injury was first picked up in 2002, and this was in El Salvador in the sugarcane industry. Young men, otherwise healthy, who did not have any risk factors to have a kidney disease, were developing end-stage kidney disease and ended up dying or ended up being in dialysis. So this is the most graphic phenotypic description of a young man in his 20s. He's a burn cane worker. If you're wondering why would you put a fire and then go into a sugarcane field when it's already 40, 45 degrees centigrade, that's because they get paid, as Barack said, they get paid by how much cane they bring back. So they do not want to get any leaves, they just want to get the cane. And the risk of getting cut by the sharp leaves, so that's why you put it on fire and then you go in with a machete in your hand, work long days, long hours, no breaks. So what started to be seen as a kind of a funky kidney disease in the 2000s was slowly being picked up elsewhere in the world. In Sri Lanka, in the southern coast of India, what's known as Udana nephropathy. But now this is kind of an old data from ILO 2020, but according to their numbers, 26 million people live worldwide who have a chronic kidney disease, and NT stands for non-traditional cause, meaning people who have kidney disease without any other traditional risk factors, such as diabetes and hypertension. There are more than 26 million people living with that kind of a kidney disease, which is attributable to heat stress. And the issue has started to hit home. This is from 2021, but as you can see, there's a clustering of and acute kidney injury cases, and this was identified with federal OSHA. We have more and more data. Given the time constraint, I was not able to include, but as Barack alluded to, there's national data where the increased ambient temperature almost matches with AKIs, both hospitalization requiring AKIs as well as AKIs in the community. And then I would like to end my talk with a couple of slides from Nepal. So the way I like to think is how the globe is warming, how the trend is. But one thing that's happening in the other side of the world is there are 50,000 young men, mostly men and some women. They leave the country, they flee Nepal to go and work abroad. A vast majority of them end up in a very hottest of the hot place, Gulf Council and Malaysia. And they end up doing the 4D job: dirty, dangerous, difficult, and dehydrating jobs. Despite the contribution that they have to the national economy, up to 30% of the GDP of country is through the remittance that they generate, they get very little care, if well. It has attracted the Western media a bit interest. People have been talking about it for at least past decade. But it was not until we in our group, Losla Network, and our partners in Nepal, when we started looking at what is the story behind the dialysis units in Nepal and the transplant hospital in Nepal is flooded with these young men. The cross-sectional study that we did, we found that 1 out of every 3 person getting dialysis to stay alive in the country of Nepal are the young returning migrant workers. Vast majority of them are less than 40 years of age. They did not have any traditional risk factors to have a kidney disease or kidney failure. And the thing that consistently was reported by, they went abroad, they went healthy, they worked outdoors, they worked under high heat. Significant majority reported extreme heat. Even higher majority reported symptoms consistent with heat exhaustion, and a large majority reported daily exposure. Thank you.
Thank you, Dr. Sharma. Our next speaker is Dr. Laurel Harduar Morano. Dr. Harduar is an associate professor in the Department of Medicine in the Division of Occupational and Environmental Medicine. Her area of expertise is occupational and environmental epidemiology, specializing in disease, injury, surveillance, and informatics. And she conducts research in the area of occupational safety and health. She's a PI on Michigan's multi-source system for tracking work-related injuries, illnesses, and fatalities. Dr. Harduar?
Thank you so much for having me here today. I really want to say I appreciate Barack's presentation before this. It was really excellent. And so for this presentation, I am going to be talking about just some population levels of data here in Michigan. I'm going to talk about Michigan, and I'm going to talk about the United States. And when we look about surveillance, how do we figure out what that population burden is? This is not an exhaustive list, but there are some data sources that we use, such as death certificates, emergency department, hospital discharge data, ambulance runs, workers' compensation claim, Medicaid, Medicare. We don't have a single source that identifies what does it look like for this burden related to heat, and that is a problem. And so one of the things that we did in our department is take a look at heat-related illness and heat in Michigan. So I just pulled the death certificates from CDC Wonder. This is an online database, and it allows us, there were 50 deaths in Michigan that had a code for heat-related illness, so that T67. So, you know, that's just the small proportion of those, and 76% of them were male. Most of them had heat stroke, so that's your severe that you're going to be seeing in relation to that. And what we see with heat stroke, 44% are 25 to 64 years old. So these are younger, healthier individuals. That's what we're seeing in Michigan for age. And so we did an analysis, and so Dr. James Hosner is here in the room and did this with me, and we looked at heat-related illness in hospitals. And so this is hospitalizations and emergency department visits here in Michigan for the years 2020 to 23. And this is over the time period. So we restricted to the years, we restricted to the time period May to September, and we can see that's where most of the heat-related illness cases are occurring, as you would expect. So we saw 4,471 hospitalizations here in Michigan. 39% of them had a chronic condition included in the record as well. So these are many of these individuals are young, healthy people or healthy individuals. And the majority of them, men, had twice the rate and twice the number of heat-related visits as women, although this varied by age group. And so this distribution that we're seeing, blue is men and green is females or women. And this distribution was very similar when we're looking at rates as well, except that for those at the higher rates here, that's where we're seeing the highest rate. And then for children, we're also seeing the youngest rate down there the lowest rate at less than 19 years of age. We also took a look at chronic conditions associated with heat, so I don't have to go into the explanation of this, thank you, Barack, about why we did this, but this is only for the year 2023 because that's the data that we had available. Looking at temperature here in Michigan, we have two distributions. The first one is the entire time period, 2020 to 2023, and you can see this is from May to September, and then the blue there is a distribution for 2023. One of the things that I want to point out is that for 2023, it was actually a cooler year with less days above 80 degrees Fahrenheit than the previous and than other years. And that tail end on the bottom is, part of Michigan. In May, it is kind of cool. And so we still have that tail end that's left skewed. So this is our analysis looking at heat-related illness as temperature increases, and we modeled this. And what we're seeing is that the risk ratios were increasing. This is compared to 70 degrees Fahrenheit. And we see an exponential increase, as would be expected for heat-related illness. Now, the majority, this is 67% of heat-related illness cases occurred between 80 and 90 degrees Fahrenheit. Again, we expect this. And again, this at the end here, we see fewer days that are happening above 90 degrees. In fact, we don't see days above 100 degrees here in Michigan. That's Fahrenheit, temperature, not heat index. So we took a look at cerebral infarction as temperature increases. Again, the reference value is at 70 degrees Fahrenheit. And we see that as we increase, so we see an increase in the number of cases, and at 86 degrees Fahrenheit, we're seeing that we see a statistically significant increase above that 70-degree time point. We do notice that there's only 37% of cases, and this is all cases that we're seeing for cerebral infarction, that are occurring between 80 and 90 degrees Fahrenheit. For kidney disease, we're seeing an increase in temperature as temperature increases to about 66 degrees Fahrenheit, and then it starts to decrease just a little bit and then starts to increase again, and right around 86-ish. Again, we're seeing it start to increase statistically significantly above that 70-degree time point. And again, about 33% are between 80 and 90 degrees Fahrenheit. So we looked at a lot of other conditions as well. And so this one are visits attributed to heat at or above 80 degrees Fahrenheit. And these are the conditions that we saw a statistically significant increase. And these are the estimated number of hospitalizations that are attributed to heat here in Michigan. So we can see, I want to point out that the bottom one is at 85 degrees Fahrenheit. So we didn't see it at 80, but a little bit higher. So prevention messages. So this is the NIOSH OSHA heat safety tool that you can download and put on your phone that uses the heat index to help workers stay safe. It includes work rest periods. It includes information on heat stroke and heat exhaustion. Unfortunately, with the cuts to the federal government and to NIOSH, I have no idea what's going to happen with this app, but it is very useful to protect workers. And then we also have the National Weather Services and CDC collaborated to do a heat risk tool. And this tool allows communities to kind of get an idea of what's going to happen. It's forecasted data plus modeled previous mortality data that's used to combine this, and gives us a kind of color-coded warning similar to the air quality index. And this is for tomorrow. You can see that most of Michigan, we're kind of in the yellow, but there's a little bit that's starting to get a bit heat, and mean moderate levels of heat that are occurring. Again, I don't know what's going to happen with this tool, but it's very useful, and the Michigan Department of Health and Human Services does use it for deciding when to do warnings. So that's all I have. Thank you so much.
Thank you, Dr. Morano. Our next speaker is Dr. Janeen Salak-Johnson. From what I understand, she's brand new to MSU, 2 days. And Dr. Salak-Johnson is a professor and the newly appointed Meadow Brook Chair in Farm Animal Health at Michigan State University in the College of Veterinary Medicine. Her research integrates basic and translational science to explore maternal-fetal interactions related to stress physiology, brain-gut immune axis, as well as the welfare of the future offspring. She is highly cited, has been prolific in terms of grant funding. In the last several years, she has obtained $14 million in funding from various sources, including USDA, NIH, and more importantly, she has mentored over 100 students, graduated and undergraduate students. So, welcome, Dr. Salak-Johnson.
So we're going to really shift gears, and some of the discussion that has already been talked about, it really does apply to our livestock, but we really have a big problem with heat stress among our production animals. And my main focus is I'm really looking at those long-term consequences, because without our breeding animals and our progeny, we wouldn't be able to put food on the table. So when we talk about heat stress, what is heat stress? And I think it's really important to talk about how animals cope with heat stress, because they have amazing physiological adaptations. They can't take clothes off. They can't see cooler environments. So they have these amazing mechanisms that allow them to dissipate heat. However, when an animal starts to experience heat stress, that means that the animal's heat load is too high for simple physiological measures to be activated, such as increasing respiration, panting, and sweating. The other struggle that we have is that depending on the species, cattle are extremely good panters, sweaters. However, pigs are not. So that creates another challenge for us among our food animals. What happens is, and this upper critical temperature, so as the ambient temperature increases and the animal reaches its upper critical temperature, which means it reaches its highest temperature before these active processes have to be initiated. Initially, that animal will enter this zone, which then allows it to start trying to really dissipate that heat to keep its temperature from rising. Unlike some of the data that they have shown in humans, it really has to hit this where welfare is compromised before you start to see a temperature rise in our animals. And they really struggle with trying to dissipate that heat load. And it gets to a point where they can no longer dissipate that heat load, and sometimes it can actually lead to death. We also know that there is a significant global increase in temperatures across the United States and the world, and this becomes a bigger challenge for our production animals. The reason it becomes a bigger challenge for our production animals is modern breeding programs really emphasize selecting animals for production traits. And the more productive an animal is, the more heat it produces. And so therefore, the more productive those animals are, they are much more sensitive to heat stress at much lower temperatures. So we really have this balance that we have to create. We also know that when an animal is experiencing heat stress, it will impair reproductive efficiency, performance, health, and overall well-being, but it also comes at an economic cost to the industry as a whole, which then ultimately will affect us because products will end up being more expensive. This cost is really associated with this decrease in productivity, along with all the health-related complications that are associated with it as well. So I want to kind of more focus on what are those direct and indirect effects of heat stress, especially when we talk about pregnant animals. This has really been an area that has been really dear to my heart, more so from trying to really put more robust, healthier animals on the ground. However, we did this study where we actually we didn't heat stress them. These were the environmental temperatures in Oklahoma in 2023. We had a drought. We had very extreme temperatures. These dams were calving in the fall, which meant that they really experienced heat stress in late gestation. So what we did was we decided to first look at the direct effects of heat stress. We categorized these dams into normal, alert, or danger, and this was based on the thermal heat index that was calculated over either 21 days, 3 days, and this was from the day of calving. And then we also have their category on the day of calving. And what this first graph shows you, let's see if I can do this right, is the fact that this is a measure of cortisol, which is a stress hormone that is in the colostrum of these dams, okay? And what it shows you is the fact that if the dam was in the alert category and her colostrum concentration levels acutely, meaning on that 3 days, they were similar to the dams that were in the normal and the danger category. However, when you look at those dams that were in the alert category, that about 21 days of heat stress, they actually had higher cortisol in their colostrum than those dams that were in the danger category. More importantly, what's interesting is no matter whether those dams that were in the danger category, whether they were exposed in that category for 3 days or 21 days, they had lower cortisol. That doesn't mean that they weren't stressed, and what it means is that the stress that they're experiencing is very different than the alert and the normal group. When we continue to look at the direct effects, because we know that those dams that were in the danger category were more stressed than those dams that were in the normal category. And that's indicative of this classical stress marker, which is the neutrophil to lymphocyte ratio. Moreover, when we look at the indirect effects, which we know that what mom experiences can have an impact on her progeny in both the short term and the long term, and what we found was on the day of calving, the dams who were in the normal category, their calves were less stressed than the calves born to the dams in the danger category. And in fact, their stress phenotype is identical. As we continue on, you can see that this is another measure of, and this is important because this can impact the health of these calves. Cattle as well as pigs, the only time they get antibodies is through that colostrum. Antibodies or immunoglobulins do not cross the placenta. And so what we're starting to see here is that depending on the category that the dam is in, it may affect her immunoglobulins, which then may ultimately affect passive immunity. If you look at this top graph, we see that once again, it's our alert and our danger categories that are different, okay? But when you look at this bottom panel, we actually see the opposite effects on the calves. So the calves acutely, which is, I don't think I'm getting this to show, but On the left-hand side, you can see when the calves are born to those dams that were in that danger category 3 days prior to calving, they actually have a reduced humoral response. And we are concerned this may actually lead to a impaired passive immunity. We are carrying out this study and we are looking at these calves as they've moved through the production chain. Once again, what we see here is this graph is showing us that if the dam's cortisol levels are high, her progeny's cortisol levels are high. So we're seeing that heat stress can not only impact the dam directly, but we also can see that it will impact the dam indirectly. Normally I would have shown this slide first, but I think to try to really explain why you might see those differences in the alert category versus the danger category. So here on the left-hand side on the top diagram, this is kind of shown, and someone alluded to this, and I don't remember who it was. But one of the things you have to take into consideration is the intensity and the duration of the stress, okay? These animals are not just exposed to heat, okay? They're also exposed to other environmental factors as well as other biological factors, whether it's their conspecifics, etc. But this graph shows you that if an animal experiences mild stress, you see some reduction in milk production, etc. But if they're experiencing extreme stress, you see that it has a much greater detrimental effect. And we think that that's probably part of it is it's not just the heat index itself, but it's also the duration of the heat index. And it's the intensity of the heat that the animal is experiencing because it's increasing the heat load. Also, the thing that I didn't tell you about this study is we also have animals that have been selected for high growth versus moderate growth. And so we probably will be able to tease out that those more productive animals are actually more at risk than those less productive animals. The other thing you have to take into consideration is these other biological factors that influence, such as genetics, which I just mentioned, adaptation and the physiological status of the animal, the animal at birth versus later on in life, and so forth. However, regardless of these other factors, we do know that the effects of heat stress can impair reproduction, contribute to morbidity and mortality, body weight, etc. And this all happens despite having these mitigation strategies in place, okay? And I think the problem is that we're getting animals that are so much more productive that we might have to change our mitigation strategies. And for me, it's more important to understand that it starts with the dam. And her progeny that she produces can end up having long-term consequences. And if we don't find a way to intervene, we can compromise health and overall well-being of these animals.